How to pass your breastfeeding OSCE in 10 steps. Step 1. Read the scenario. Read the scenario, then reread it. Really read it. What is it telling you? Take this example of a scenario. Fatima is 5 days post-delivery. She is breastfeeding her new baby but has sore nipples and an unsettled baby. Please assist her to address these issues. Okay, so what does it tell us? Well, firstly, it tells us the mother's name. So you can refer to the mother by her name, which will show how your approach is personable and how you build rapport. Also, we know that Fatima is 5 days postnatal. So, by picking up on this, you can demonstrate your knowledge, for example, by discussing with Fatima how many wet nappies she should expect at this stage. Crucially, we also know that Fatima is suffering from sore nipples, so you can already be thinking about what support and advice might be the most appropriate, such as positioning and attachment. Another clue is the information that the baby is unsettled, which should get you thinking again about positioning and attachment and whether the baby is getting enough milk. That's a lot of information for you to start with, and only in 3 sentences. Nerves can mean that the most obvious things are overlooked, and missing something obvious in the scenario may mean a lower mark. Asking how old the baby is when it tells you in the scenario will make the examiner think you haven't read it properly. Referring to the baby's age and its relevance will show that you've paid attention as well as displaying your knowledge. Step 2. Introduce yourself. So now you've read and understood the scenario, you should start by introducing yourself. It's easy. My name's Judith and I'm one of the midwives, and I'm here to support you with breastfeeding. Communication is key in any OSCE, and the examiner will be looking out for a clear voice, open body language, good eye contact, that you use plain language and avoid jargon, and that you listen. That's really important. Also, that you have a friendly manner, so don't forget to smile. Step 3. Wash your hands. If there is a sink, use the sink to wash your hands, but if there isn't a sink, make sure that you'd say that you would do this. Step 4. Obtain a history. This calls for skillful questioning. You will need to use a combination of open and closed questions. Open questions will allow the mother to tell her story and identify her needs. Some closed questions might be necessary for you to gain a full history. And remember, respond to the answers that you receive. For example, if the mother tells you that she's had perineal trauma, ask her if she's comfortable or needs pain relief before continuing. Step 5. Explain the physiology of lactation. Some students worry how they can demonstrate their knowledge of the physiology of lactation when interacting in a role play with an actress playing a nursing mother. Well, here's an idea of how you might do that. By explaining about the hormones of lactation, you can discuss the role of oxytocin and how best to stimulate the release of oxytocin. So you may say something like, Fatima, I want to explain to you how important a hormone called oxytocin is for breastfeeding. Oxytocin is released when we're feeling relaxed, safe, and loved. And in a woman's body, it's responsible for the ejection of the milk. You might have heard or have even experienced the letdown, as some people call it. You might have experienced a tingling sensation in your breasts and nipples when the baby begins to feed. Well, that's oxytocin moving the milk out towards the baby. So you can see it's important to encourage your body to release oxytocin, and being relaxed and comfortable is important, and skin to skin contact will work really well as well. You should also talk about the demand and supply nature of breastfeeding, which again will help the mother to understand the importance of regular feeds, as well as what might be happening with engorgement. Step 6. Explain the benefits of breastfeeding. It's really important to include information about the benefits of breastfeeding in your OSCE, as you will need to demonstrate your knowledge. To make this seem more natural, you can start by congratulating the mother on doing so well with breastfeeding and encourage her to persevere because of the good work she is doing for both herself and her baby. Refer to the UNICEF Baby Friendly Initiative website for the latest evidence as to the benefits of breastfeeding. Generally speaking, you might mention the benefits to the mother, to the baby, and to the relationship between the two. Step 7. Observe a feed. First of all, remember appropriate touch. If possible, take a hands-off approach, but if you wish to touch the mother or the baby, always ask permission first. And ask the mother if it's okay for you to observe a feed. Explain that this will help you to get an understanding of what the problem might be, for example, attachment and sore nipples. Always start by asking if she is comfortable and offer pillows for under the baby and behind her back. If she accepts, remember to actually put the pillows in place. You'd be surprised how many people don't do this in an OSCE. And then check back in with her to see if she's really comfortable, and advise that she always has a drink nearby when she's feeding. So begin by talking about feeding cues and what she should look out for, and then ask her to put the baby to the breast so you can both see what's happening. So now you need to demonstrate how you would actually observe a feed, and this calls for a bit of acting. Once the baby is on the breast, check back in with the mother and ask her how it's going. If she says it's all fine, double check. Is she experiencing any pain or discomfort? If yes, then advise taking the baby off the breast using her little finger to take the baby off, and be clear that she shouldn't continue with the feed as it will be damaging the nipple and the baby will not be getting adequate amounts of milk. Then move on to using the mnemonic chin to take the mother through correct attachment and positioning. We'll move on to this really soon. If the mother says she's not experiencing any pain or discomfort, then still work through the chin mnemonic to explain to her how she knows the baby is attached and positioned correctly. So now you can explain to the mother about the signs of good attachment. And so for a bit more acting, say to the mother that you can see the baby is attached properly because you can see that the baby has a wide open mouth with more of the areola seen above the top lip. Say that you notice the initial rapid sucks are turning to slow, deep sucks and that the baby appears contented. and it isn't uncomfortable for the mother. At this point, you might want to say that whilst the baby is feeding, you'd like to explain about the signs of thrush, so that the mother can be aware to look out for them. Explain to her that sometimes sore nipples can be as a result of thrush. Go on to say that symptoms of thrush include deep breast pain or severe nipple pain. Explain that pain from thrush often starts after a period of pain-free feeding, and the pain tends to be a burning, itchy pain. In an OSCE, a generic explanation that thrush is treated with antifungal treatments and that both the mother and baby should be treated together will suffice. And at this point, check back in with the mother. Ask her if she's still comfortable. Okay, so as promised, here's the chin mnemonic. So C is for close. This reminds the mother to have the baby close to her body, tummy to mummy and skin to skin. H is for head. This reminds the mum to keep the baby's head free to move backward and forwards in order to attach to the breast. I is for in line. Explain that the baby's head and body need to be in a straight line. Either show how the baby is currently in a straight line, or if it isn't, ask permission to help the baby to move into the right position. And N is for nose to nipple. Explain that this will help her to remember to aim the end of the nipple towards the top of the baby's top lip, and when she waits for a wide open mouth and brings the baby onto the breast, the baby will have a mouthful of breast. Step 8. Discuss hand expressing. Next, you will need to discuss hand expressing. Again, you may put it to the mother that whilst the baby is feeding, you can give her some useful advice. This is especially important if you have engorgement as part of your scenario, but always include hand expressing anyway. You may have a prop such as a knitted breast to hand, and if so, use that to demonstrate. If there isn't one available, say that you would normally use one, but then be prepared to give a verbal explanation. Also, remember to point the mother to resources she might find useful for more information. I would highly recommend you suggest to the mother that she watches the videos on hand expressing on the UNICEF's Baby Friendly Initiatives website. This shows you know about UNICEF and the BFI, but also shows you're aware of signposting the mother towards useful resources. Step 9. Make a plan. It seems that when a lot of students get to this point of the OSCE, they breathe a sigh of relief and think because they've got all the info across that they've finished. However, failing to make a plan will lower your mark, as it would be a crucial part of breastfeeding support in real life. Agree your plan with the mother, and not only when she will next get some professional input, such as a postnatal visit, but also what she can do meanwhile, for example, if she's struggling in the middle of the night. Step 10. Document. Again, so many students just forget to mention documentation, and it's so important that this is included. Remember to document your assessment, your discussion, your plan, and any actions. In the OSCE, you could tell the mother what you're going to write in her notes. Perhaps you could say something like, "So Fatima, now I'm going to write all this down in your notes. I'm going to write about the feeding, what the problems are and what I've observed today. I'm going to write down everything we've talked about and everything we've done together today as well. I'm also going to put in there what the plan is. Is there anything else you think I should include? And perhaps it goes without saying, but always finish by thanking the mother and asking if there's anything else she needs. And finally, there'll be some time at the end of the OSCE for reflection. For this part, you should use a reflective model such as Gibbs or Rolf's. This will help you avoid just recycling what you've just said so far and show an analysis of your performance. You can use this time to include anything you've forgotten or correct any mistakes. But remember, the examiner will be marking you on how you reflect on your performance and practice. And so now watch this short video on breastfeeding support from Baby Friendly UK. It's a great example of observing a feed, of positioning an attachment, and of the cross cradle hold.
Although she began breastfeeding baby Rufus as soon as she could, Teresa needs reassurance. She has asked Nikki, a breastfeeding peer supporter, to come and make sure Rufus is feeding properly.
Rufus, I can observe a little feed maybe later. Do you think would he be ready to feed now?
He might be.
Nikki explains that if Teresa's baby attaches correctly at the breast and feeds well, it will help her establish a good milk supply for the future and overcome their difficult start.
Just for attaching him, you could try attaching him in cross cradle. Do you know what I mean by that?
Is that where I can see it, where you put your arm across like that?
That's right. And aiming nose to nipple.
Nikki shows Teresa how to achieve good attachment. Bring the baby's nose directly opposite the nipple. Let his head tip back a little so his top lip can brush against your nipple. This should make him open his mouth. When his mouth is wide open, bring him quickly to the breast with his head back and chin leading. The baby can then take a large mouthful of breast, not just the nipple. The breast will be drawn deep into his mouth, so your nipple will go all the way back to the soft part of his mouth, and you won't get sore. So, once your baby's head has tipped back, your nipple will brush his top lip. Wait for the wide gape, then bring your baby quickly to the breast, chin leading. In this position, feeding will be comfortable and your baby will be able to take all the milk he needs.
So long as you've got your position and attachment right, it should be like that. It should be nice and relaxed and enjoyable.